Today's topic is on etiology of congenital heart diseases. Congenital heart diseases are multifactorial disorder where both the genetic component is there and it has an environmental effect. In about 90% cases, the etiology is unknown, but in 10% cases there are some etiological bases, and those we are going to discuss today. Number one etiology is genetic inheritance. So many of the congenital heart disease, it has a autosomal dominant mode of inheritance, or it may be associated with the autosomal dominant disorders. So examples: atrial septal defect, supravalvular aortic stenosis, cardiomyopathy has a dominant pattern of inheritance. Osteogenesis imperfecta is an autosomal dominant disorder, and here aortic regurgitation is the commonest congenital heart disease we get. Another autosomal dominant disorder is Marfan syndrome. Here also the aortic valve is involved and there is aortic valve incompetence, same as aortic regurgitation, or aortic dilatation is there. Some of the congenital heart disease, around 5% cases, are associated with some chromosomal abnormalities. Example: 18 trisomy, that is Edwards syndrome. More than 90% cases is seen to be associated with the congenital heart disease. The commonest heart disease noted in this disorder is ventricular septal defect, patent ductus arteriosus, double outlet right ventricle. 13 trisomy, also known as Patau syndrome, more than 80% cases has dextrocardia, VSD or PDA. 21 trisomy, that is Down syndrome, 50% cases is associated with the congenital heart diseases, and AV canal defect is the commonest congenital heart disease noted in this. Other is VSD or ASD, that is of ostium primum type. Turner syndrome, that is in this case 40% cases has aortic coarctation of aorta or aortic stenosis. Deletion chromosome 22q11, that is a DiGeorge syndrome, has a congenital heart disease VSD, and there are familial cardiomyopathies noted: hypertrophic cardiomyopathy and dilated cardiomyopathy. Number 2, coming to gender, it is noted that in males and females, congenital heart disease are occurring with an equal frequency, but some congenital heart disease are more commonly seen in males, like aortic stenosis, coarctation of aorta, and patent ductus arteriosus and atrial septal defect is more commonly seen in females. Now coming to environmental factors associated with high altitude. In a high altitude, patent ductus arteriosus and atrial septal defect are noted to be more. And maternal factors, this is one of the big environmental factor where many maternal conditions are associated with the congenital heart disease. So number 1, if the mother has a congenital heart disease, the baby to have congenital heart disease is 5 to 10%. Number 2, if the mother has a diabetes during the gestation period, the baby might be born with the congenital heart diseases like TGA, that is transposition of great arteries, ventricular septal defect, situs inversus, single ventricle, hypoplastic left ventricle. If the mother has a SLE, there are chances that baby will have congenital third degree heart block. And if mother has infections like torch infection, especially rubella, the baby will have PDA, pulmonary stenosis, VSD or ASD. If the mother has mumps during the gestation period, then baby might have endocardial fibroelastosis. And now number 4, there are certain drugs which may affect. If the mother takes the following drugs, the baby might be born with all those congenital heart diseases. With lithium, tricuspid valve abnormalities, Epstein anomaly is common. thalidomide intake, there is variable congenital heart diseases. Alcohol abuse, there might be ASD, VSD. Phenytoin or valproate, there might be ASD, VSD or tetralogy of Fallot. And coming to baby factors, if the baby has omphalocele, the baby might have tetralogy of Fallot. With imperforate anus or esophageal atresia, baby has tetralogy of Fallot or complex single ventricle. If the baby has a perinatal asphyxia, baby might have tricuspid regurgitation, mitral regurgitation or ventricular dysfunction. Thank you. We'll see you in another class with another topic.